From South Florida, this is Headliners, only on CBS News Miami.
Hello, everybody, and welcome to Headliners. I'm Elliot Rodriguez. The man accused of killing the UnitedHealthcare CEO is now in custody in Pennsylvania. Luigi Mangione is now awaiting extradition to New York to face a murder charge. But as we learn more about the disturbing incident that happened in plain sight in Manhattan, new concerns and questions are emerging. It's on the growing threat of the so-called ghost guns, like the one police say was used in this crime. CBS News Miami's Steve Magiri has more on the story.
These 3D printers can be bought by anyone and can be set up in a place as simple as your garage. A retired Miami police chief says that it is legal to make these ghost guns by using a 3D printer. Marcelo Nader runs his 3D printer business out of his garage at his home in Kendall. All he has to do is download a design, set it, and forget it.
I can take that data, put it in the computer, and create the item of what the client wants.
Even a gun?
Even a gun.
It took just under an hour to make this little replica, but this might be more fitting for a G.I. Joe doll. To make a full-sized one, Nader says it is possible, but he would need much stronger materials and a much bigger machine. This is what's known as a ghost gun. The Justice Department released a report last year saying that the use of ghost guns in crimes has risen 1,000% since 2017.
I have no tolerance, nor should anyone, for one man using an illegal ghost gun.
Police say Luigi Mangione was carrying a ghost gun when he was arrested in Pennsylvania. George Kalina is a retired Miami police chief. He says there's no serial number or a record of these 3D printed guns being made.
You didn't have to give your name. You could have paid with a debit card.
Kalina says these are dangerous for those with bad intentions because you can just order the parts online in a kit and build it at home. State lawmakers tried to pass a bill banning manufacturing a gun at your home, but it failed in 2022.
The laws that are created to protect people from dangerous folk, that doesn't come into play here because you're buying this weapon anonymously. You don't have to provide a name. You just need to provide payment.
Nader says he doesn't build guns at his shop, and for most people, it isn't worth the expense.
If you're going to spend all that money to make a gun, you're better off just buying one.
And as for the legality of these ghost gun kits, that issue is being taken up right now by the U.S. Supreme Court. In Kendall, Steve Magiri, CBS News, Miami.
Now, since the murder of UnitedHealthcare CEO Brian Thompson, there has been quite the public outrage on social media, with people venting their frustrations over the health insurance industry in America. CBS News Miami's Anna McAllister spoke with an insurance claim attorney to get some answers.
Millions of Americans are weighing in with grievances about healthcare insurance after UnitedHealthcare CEO Brian Thompson was brazenly shot and killed in Manhattan last week. Since his death, people have taken to social media to express their frustrations, many sharing how denied insurance claims have affected their lives. So we sat down with Russell Lazaga, an insurance claims attorney based in South Florida, and asked him, what do you do when your claim is denied?
You have to go through the insurance company's own internal appeal process. And what a lot of folks don't know is that when you do that, you're creating a record for any future case or challenge to that appeal decision.
Lazaga adds it's critical to meticulously document every step of the process because if you fail to do that, it won't be considered later. He says getting an attorney is your best bet, but he says it won't be easy.
Very often, if the insurance is through your work, you have to go through a very rigorous appeal process, a lot of legal work to put that together. And there's no way to get paid if the insurance company denies the appeal and you have to go to court. The only way you can get paid is from the client who's already struggling.
Lazaga says a majority of times he has to deny taking on clients because of this. And he says time is often of the essence.
Got an insurance company fighting on the appeal and oftentimes trying to delay that, figuring it's cheaper to hire lawyers and fight you than it is to pay the doctors to save you.
Lazaga adds insurance companies often will try to wear people out, so they'll go away. He says the best thing you can do is to be vigilant with your documentation and to be persistent.
Be your own advocate. You've got to be your own best advocate. If the insurance company is telling you no, and your doctors are telling you yes, or your health and your own conscience is telling you, yes, I need this, this is helping and benefiting, then do the work to advocate.
And some insurers are rejecting nearly 1 in 5 claims. That's according to a 2021 analysis done by KFF, an independent source of health policy research, polling, and journalism. And Lazega says it's important to get that early documentation for your appeal if your claim was denied. But for now, reporting from Miami, Anna McAllister, CBS News, Miami.
When we come back, the dangers of delaying health care, the dilemma some people are facing as they weigh paying for their household bills or to take care of their health. When we come back.
From South Florida, this is Headliners, only on CBS News Miami.
Welcome back. I'm Elliot Rodriguez. The recent murder of UnitedHealthcare CEO brought with it a flood of complaints. They're concerning the health insurance industry in this country, and in some cases, healthcare executives promise to do better by people being forced to choose between their health or putting food on the table. CBS News Miami's Joe Gorcho caught up with one woman who is delaying her own health care.
I worry about that every day, especially at my age.
A constant concern lingers with Oli Trigo.
We talk about how we can be able to come with funds to be able to go see our doctors.
And sharing her financial hardship as the bills pile up, prioritizing household and family needs over her health.
Now I need to do the roof in my house, and they're saying I have to replace it when there's nothing wrong with my roof, and they're increasing my homeowner's insurance to $13,000.
The 60-year-old living in Westchester says she postponed multiple medical appointments in November. She needs a heart flow analysis and a colonoscopy.
Unfortunately, I cannot do my colonoscopy because I don't have the money. Because of the deductible, it's $3,000.
She's not alone in delaying care. A study by Harmony Healthcare shows that 26% of Americans plan to put off medical procedures in 2025 due to cost. And 1 in 3 Americans plan to skip going to the doctor entirely to save money.
The dangers are the issue can become more complex and more serious and life-threatening.
Dr. Michelle Adibe with Baptist Health understands the tough decisions patients face when balancing health and finances.
When you come to your doctors early, we can catch these things early, and then we won't run into the issues of it becoming an extreme financial burden. Be able to get you procedures or medications that may not be costly at that time.
Dr. Adibe suggests checking in with your doctor at least once a year. That's especially true for younger adults, who she says tend to skip preventative care checkups the most.
Knowing that we're seeing a higher prevalence of these diseases like cancer in younger populations, I think should push the younger population to come in to see their primary care doctor and just get screened. You know, preventative care is absolutely fundamental to a patient's well-being and their overall health.
While Trigo willingly sacrifices her health, she says she would never risk that of her husband or 2 kids at home.
Their help comes to me first right now. If they have an emergency, I would give anything. I would sell my car if I had to.
Baptist Health and other healthcare systems offers multiple options for patients needing care, but simply can't afford it. At Baptist, that help ranges from charitable care to financial assistance programs. Meanwhile, another solution, medical credit cards. But make sure you read the terms of agreement to truly understand the risks and benefits. Reporting from Miami Beach, Joe Gorcho, CBS News Miami.
Lung cancer is killing Floridians at an alarming rate. Adding to that is that many people at high risk are not getting diagnosed soon enough, which means they're being robbed of more time. CBS News Miami's Joe Murray has one survivor story and a doctor's message we all need to hear.
It started like you start gasping and there's no way you can breathe at all.
Issa Mendez's breathing trouble turned out to be lung cancer. After 11 months in remission from uterine cancer in 2017, she learned the cancer had jumped and was spreading fast. Doctors removed her lower left lung. They were dark days.
You can't sing anymore because you lose your breath. You can't laugh without actually having some kind of pain in the area. So everything changes in a way, but it's how then you adapt and you motivate yourself to get better.
When chemo wasn't making her better and she was given months to live, Mendez pushed to be put on an experimental immunotherapy drug.
I think by the 1.5 years, my body had totally disappeared. I was clean. I was totally clean.
What was that like?
Hope, life, amazing. It's like I got a second chance.
That second chance is possible, but too often ignored. Florida's lung cancer rate is high. 54 out of every 100,000 people diagnosed. Only about a third survive, and that's because only 25% get diagnosed early.
I find it very alarming. I think right now early detection is a real problem.
Cardiothoracic surgeon Dr. Sean Johnson at HCA Florida Northwest showed us an advanced scanner that can detect lung cancer early, but he said we need to do a better job of reaching people at highest risk, like smokers, those exposed to secondhand smoke, and asbestos, a family history, and recognizing in the Hispanic community, lung cancer tops all other cancers.
If we do a better job at screening and diagnosing early, we can treat and potentially save a patient,
Saving patients is part of Isa Mendez's mission too. She advocates for detection, treatment, and cures for lung cancer, while literally climbing mountains to improve endurance and shed a light on the devastating effects of lung cancer.
Leading, inspiring, and helping others to take action becomes part of, it was worth going through this because now I can help other people.
There have been a lot of advances in lung cancer treatment, but early screening is your best defense. In Margate, Joan Murray, CBS News, Miami.
When we come back, Christmas came early at a South Florida hospital. See the smiles you won't want to miss. Next.
From South Florida, this is Headliners, only on CBS News Miami.
Welcome back to our show. I'm Elliot Rodriguez, and right now we have an all-new Miami Proud. We are recognizing a resource center for parents who have children with disabilities. Parent to Parent has been in Miami-Dade County for 38 years, helping thousands of families here. CBS News Miami's Lisette Gonzalez shows us how the organization is making a real difference.
It is an organization that is close to my heart and so many parents because we are here for parents.
Fadi Garcia is the CEO and president of Parent to Parent of Miami. She has dedicated her life to helping parents of children with disabilities because she has been on that same journey with her son David, who was diagnosed with autism at an early age and is now 25 years old and thriving.
Our mission is to empower and support a network of parents who have children with disabilities. And so the majority of our staff are parents who, for most part, also have been helped themselves.
Parent to Parent provides information, workshops, guidance, and support so that parents can help their child fulfill their potential.
We have workshops on so many topics. We can be talking about behavioral supports. We can be talking about early intervention. We can be talking about ADHD, dyslexia, anything that, disability-wise, we bring those topics and those professionals here to our office so that the parents have the information they need to make those good, wise decisions for their kids.
Every year, Parent to Parent helps thousands of parents of children with disabilities like Nicole and her son Jack.
I think every parent needs to know that there are resources. Whenever you get a phone call from a school, whenever you get a diagnosis from a physician or from any other provider, it feels very lonely. So even though my son has all his challenges, I think as a parent and most parents, we always think of our kids' future. And are they going to be okay? Are these challenges going to impede them from, a typical life? And Parent to Parent has really given me hope and guidance on how to get him there.
I've had the honor of serving as MC of the annual Parent to Parent Journey of Dreams fundraising gala the past few years, and I'm always moved to see these bright, talented children and their supportive parents who are helping them dream big.
That's one of our big mottos, dream big for our kids with disabilities. We want them to believe that their children can overcome, can grow, there's no limitations for what they can do.
I'm very passionate about Parent to Parent of Miami because it is such a wonderful organization, making a difference in the lives of so many parents and their children. If you would like to support Parent to Parent of Miami, you can find more information on how to donate or volunteer at ptopmiami.org.
That was Lisette Gonzalez reporting. A special surprise for young patients at Joe DiMaggio Children's Hospital. 60 patients and loved ones boarded a magical United flight to the North Pole. And CBS News Miami photojournalist Adam Spunt came along for the ride.
We're going to the North Pole. Santa, here we come.
This is the second year we've done the United Airlines Fantasy Flight, and it is such a special day. We have over 30 families. That includes patients from Joe DiMaggio Children's Hospital, siblings, parents, grandparents, going to the North Pole.
Hope to see snow and Santa.
It just makes the season even more magical, despite all the hardship that we go through as a family who battled cancer and still ongoing. And it takes the stress of the season away to be able to give our child something magical.
We'd like to begin by boarding our families with children to board at this time for your flight to the North Pole.
And I am privileged today to be one of the pilots up front on our flight all the way to Hoboken, the North Pole. I'm sorry, we're not going to Hoboken, New Jersey today. The North Pole.
The jetway and the gate, everything was decorated out. They had so many different people there, and just costumes, and Elsa, Anna, everybody. Then to land in the North Pole and get here has just been incredible.
It's a day out of the hospital for a weekly basis, and a day of magic.
I was really excited to come and see Santa and to make new friends and have fun.
We know these families, we know their stories, we know what they're going through, and for us it just is something so magical and so special, very emotional, for us to be able to see them having a blast, having fun, smiling.
We're at the North Pole and I'm having so much fun.
The smiles on their faces says it all. And thank you so much for joining us this hour on Headliners. As always, keep it right here on CBS News Miami for up-to-the-minute breaking news and weather 24 hours a day. Make it a great day.